So hi everyone, so I am Sridharan, assistant professor from the SNS College of Physiotherapy. So in this video we are going to see about the topic is nothing but the spinal muscular atrophy, which is also known as SMA. So what is spinal muscular atrophy? It is nothing but a genetical neuromuscular disorder. So it causes to the progressive degeneration of the motor neurons specifically present in the spinal cord. So it finally leading to the condition which is nothing but the muscular weakness. It is also known as the atrophy. So pathology for this condition is the degeneration of the anterior horn cells in the spinal cord, which can lead to the denervation for the skeletal muscles. So these are all caused by the mutation or else also a deletion of the SMN1 gene, so which is nothing but the survival motor neuron gene. Okay, so there are different types of SMA. So they are which is classified as an SMA type 1, SMA type 2, type 3 and type 4. So these are the 4 different types of the spinal muscular atrophy. So in the first type, it is mostly severe type. It also onsets up to the onsets above 6 months. Then in type 2, onset lies between the 6 to 18 months. Then in type 3 it is milder, and in type 4 it is very slow progressive types of spinal muscular atrophy. So causes for the spinal muscular atrophy are autosomal recessive genetic disorder, and then it is also caused by the mutation or the deletion of the SMN1 gene, and then it is also genetically carried from the parents, grandparents likewise. So the carrier parents have the 25% of chance passing to its offsprings. So what are the clinical features for this SMA are the progressive muscle weakness and the hypotonia. So hypotonia is nothing but the reduction in the muscle tone, and then second clinical feature is delayed motor milestones, then tongue fasciculations and absent deep tendon reflexes, and then respiratory distress in the severe cases, and finally difficult feeding difficulties, and also leads to the scoliosis. So what are the different kinds of investigative methods which are used to identify the SMA are? So first one is genetic testing. So in this genetic testing, the SMN1 gene mutation analysis can be held, and then second type of investigation is electromyography, which shows the denervation for the skeletal muscles. Then third one is muscular biopsy, which is rarely needed now, and lastly it is nothing but the creatine kinase, which is also called as CK levels in our serum level, which shows that mildly in the elevated state. So there are different kinds of managements for the conducting for the SMA condition. So in this condition, for medical management, so some of the drugs were prescribed for this condition. In the first one is nusinersen, so which is mainly helps in the increasing SMN protein level in our body. Then second one is which is called as an Zolgensma, which is a gene therapy. Then third one is it is an Ricidiblam, so it is an oral drug which is used as an SMN splicing modifier. And lastly supportive treatments are such as bronchodilators, antibiotics for the infections. So in the severe cases, it can be leads to the surgical management. So in severe cases, the spinal surgery is conducting for correcting the scoliosis, and then gastrectomy tube placement for the feeding support, and finally tracheostomy in the severe respiratory compromissive conditions. So other than surgical and the medical management, so some other treatment methods have been also conducted. It is in a rehabilitative state. So according to the rehabilitative management, so first one is in a physiotherapical management. In physiotherapy, so what are the exercises have been prescribed for the spinal muscular atrophies are? So first one is range of motion exercises, and second one is for chest physiotherapy, which helps in increasing their breathing capacity, and then thirdly the occupational therapy is for adaptive strategies for the patients, and last and third one is speech therapy. So speech therapy is for the patients who are having the difficulty in swallowing, and finally the nutritional support and the mobility aids were being prescribed for the patients who have been affected by the spinal muscular atrophy. So see you guys in next video.